So typically, first let's start with a diabetic. What is the difference between a type 1 and a type 2?
Someone with type 1 diabetes cannot produce their own insulin in enough volume to maintain blood sugar, because one of the key features of insulin, functions of insulin, is to reduce blood sugar and keep blood sugar at an even rate. Um, and someone with type 2 diabetes has more than enough insulin. In fact, most people with type 2 diabetes have too much insulin, and theirs is due to an overfueling issue such that their body cannot handle the amount of fuel that they're putting into their bodies, mostly carbohydrates. So there's a big difference between the two conditions. Type 1s, we need to inject insulin because we don't produce any. And in type 2s, they need to adopt a lifestyle strategy that naturally reduces the amount of insulin they're producing. So they're not at all comparable conditions.
So if insulin lowers blood glucose and a type 2 has high insulin, shouldn't they have low blood glucose?
They become insulin resistant. This is the problem. People with type 2 diabetes, various ideas on it, but their fat cells sort of stop the body sort of taking on more fat, and they become resistant to the amount of insulin they've got, because as well as lowering blood sugar, insulin is a hormone that stimulates fat deposition. So it's a fat storage hormone as well as a glucose lowering hormone, and the two things work together. So in order to lower blood sugar, you either exercise or you put it into your liver initially, and then into your adipose tissue, your fat tissues, as fat. So we think of insulin as a glucose lowering hormone and a fat storage hormone primarily.
Okay, so when someone is a type 1, they don't have the insulin to regulate blood glucose. So what's going to happen when they start exercising and not eating? They don't have fuel. They're obviously they have to tap into their fat reserves, right? Um, and talk a little bit about that, as well as a really key issue, which is adapting to running on fat or ketones. Explain that process.
Our body can multi-fuel, so we can use sugars and we can use fats for our fuel. And of course, fats will break down into ketone bodies, and we can use ketone bodies as fuel as well. So in the ideal situation, our bodies can flick between whatever fuel they need for the requirements at the time. So whether you have type 1 diabetes or not, if you're performing exercise as like a sprint without any oxygen, you will have to use glucose for your energy source. But if you're doing a more aerobic or more relaxed amount of physical activity, you're burning oxygen, and you can choose really whether you're using glucose or fat as your fuel. However, you're limited a little bit as to how you can select your fuel, because if you have too much insulin on board, you're blocking fat burning. So fat burning is impossible if you've got too much insulin on board. Now, people do burn fat when they are exercising, and there's this fat burning zone, which is otherwise known as zone 2, because there's a hormone called hormone sensitive lipase, which enables fat to be burned, and that is also stimulated by lowering insulin or adrenaline, cortisol, growth hormone, things like that. So stress hormones will release that. But if you have too much insulin, it will override those hormones and block fat burning. So then you become entirely dependent on glucose. So most people with type 1 diabetes will be dependent on glucose because they're not encouraged to burn fat. So we tend to have too much insulin on board. So our bodies are multi-fuel. We can flick between fuels as we need them. And if we're fat adapted, all that means is that your fueling choice for your food will be low carbohydrate. So low carbohydrates require less insulin to either be injected or for your own body to produce insulin, because as type 1s, we're exactly the same as people with no diabetes and our insulin requirements, except we just know how much insulin a non-diabetic body would need for the same requirements. So a fat burning body has to have low insulin levels in order to release the fat. Are you still with me at that
Yeah,
point?
yeah. So basically, in order to get into the fat burning, we must lower insulin. That's really the key factor, right?
Exactly. So then we can free up the fat burning, and when we're adapted, and it takes about 2 to 3 weeks to fully adapt. Some people would say it takes even longer, and then your body will naturally burn fat quite happily, produce ketone bodies, and have a very low requirement for sugar. The important thing about glucose or sugar is that we don't need to eat sugar in order to produce it. Our body will produce more than enough for our requirements. And an obvious example of that is those poor people that get pulled out of disaster zones like earthquake zones, and they haven't eaten for 6 or 7 days, but they haven't expired because they are producing enough energy for their body requirements, some of which will be sugar. So we respect the fact that our body's multi-fuel, and we wanted to show in this 100-mile run that we can safely use ketone bodies and fat as fuel and have no requirement for insulin. No requirement for sugar at all.
Incredible.